Welcome back to Emergency Insights. I'm your host, James Carter, and today we're tackling an important question. Can adenosine be used to treat PSVT associated with WPW syndrome? Adenosine is widely recognized as the drug of choice for terminating paroxysmal supraventricular tachycardia, or PSVT. Its mechanism is well understood. It transiently blocks AV nodal conduction, effectively breaking the reentry circuit responsible for the arrhythmia. In patients with Wolff-Parkinson-White syndrome, or WPW, adenosine can still play a role, particularly in cases of orthodromic AV reentrant tachycardia, where the reentry loop involves the AV node. By blocking the AV node, adenosine interrupts the circuit, restoring normal rhythm. However, and this is crucial, adenosine's effects are limited to the AV node. It does not suppress conduction through the accessory pathway characteristic of WPW. This becomes a major concern if the patient develops atrial fibrillation or another atrial tachyarrhythmia. In such cases, blocking the AV node could leave the accessory pathway unchecked, allowing rapid conduction to the ventricles. The result? Dangerously high ventricular rates, potentially escalating to ventricular fibrillation and cardiovascular collapse. So, what's the takeaway for clinicians? Adenosine can be used in WPW-associated PSVT, but only under strict conditions. Ensure continuous monitoring and immediate access to advanced cardiac life support, including defibrillation capability. The risk of precipitating a life-threatening arrhythmia while low must never be overlooked. That's all for today's episode of Emergency Insights. Stay sharp, stay prepared, and we'll see you next time with more critical updates for emergency care.